Hello, welcome to our channel. Today we are going to be discussing a very important topic, chlamydia infection. We're going to be looking at the major questions that people keep asking about this particular infection. We're going to be looking at the signs and symptoms of this infection, the causes of this infection, how to prevent this infection, and of course how to treat this infection in case you are having it. So if you are seeing my face for the first time, do well to hit on the subscribe button so you can be getting more videos like this every day. And don't forget to watch this video to the end so you can get the information I have for you about this particular infection, because chlamydia is not just an infection but an infection that can lead to other infections in the body. It affects both men and women. It can cause abnormal discharge, it can cause pain while urinating, it can cause itchy sensation around your vulva, around the penis area. It can even cause infertility and PID infections. So do well to watch this video to the end so you can get the necessary information you need to get about the prevention, the treatment, the causes, and also the signs and symptoms of chlamydia infection. Chlamydia infection is a sexually transmitted disease that is caused by the City bacteria, the Chlamydia trachomatis bacteria. And there are two major ways in which this bacteria gets into the body. There are two major ways in which you can contact these bacteria into your body. And one of the ways in which people get this bacteria without them knowing is unprotected sex. If you're the kind of person that likes sex without protection, you like oral sex without protection, because there are ways in which you can protect yourself from infections while you are carrying out oral sex. There are still ways in which you can prevent yourself from infection through anal sex. There are ways in which you can prevent yourself from infection through vaginal sex, and I'll be explaining that in this video. So you can get this infection into your body through unprotected sex. The second way in which people get this infection is through childbirth. As a mother who is infected, or as a pregnant woman who is infected, you have a high chance of transmitting this bacteria to your baby if you don't treat it while you are pregnant or before you get pregnant. And that's why it's always important you go for antenatal so they can check you to know if you're having any infection. And if you're having any infection, they will treat you before you deliver your baby, because when you don't treat this infection while you are still pregnant, you will have a high chance of transmitting it to your baby. And when you transmit this infection to your baby, finally it can cause eye problem. So you notice you giving birth to a baby who have eye problem, the baby will be discharging fluid from his eye, having color issues, having some kind of abnormality in his or her body. And this is all caused by this particular deadly infection. So it's very important you prevent yourself from this infection as a woman who is wanting to get pregnant, or as a woman who is pregnant, so you cannot get the complications that has to do with this particular infection. Sometimes this infection will not show it is in your body. It will be asymptomatic. You will have it and you not even know you are having it at all. But there are ways in which you can check yourself to know if you are having it. And one of the ways is through carrying out a test. You can carry out a urine test, you can carry out a vaginal swab test or a penile swab test. You carry out a urethral swab test to check if you're having this bacteria in your body. Because the fact that it doesn't show in your body does not mean it will not affect you, does not mean that you can't transmit it to your baby, does not mean that it can't cause infertility. It doesn't mean that it will not cause PID. It will still cause PID even if it's not showing symptoms. So that's why you can see a person very healthy and the person will say, I don't know how this infection just came all of a sudden. That infection has been in your body for a long time. You see a man saying, I'm having infertility, I'm not producing healthy sperm, my scrotum is paining me, I'm having low sperm count and I don't know what is the cause. I don't take alcohol, I don't take drugs, I don't have an infection, but you have been having chlamydia in your body system for a long time without you knowing. And that's why it's always advisable you have yourself checked from STIs generally every year, so you can screen out most of these infections from your body so you not have complications that has to do with them. Now, there are major signs and symptoms that this infection shows into the body, both for men and women. And one of the ways in which this infection shows itself in the body is having an abnormal discharge in the vagina. You have a kind of foul smelling discharge from the vagina. You have itchy vagina, itchy penile area. You have discharge coming out from your penis as a man. You have, kind of burning sensation while you are urinating. You have pelvic pain. Don't forget that this infection can make you have PID, pelvic inflammatory disease, where all the organs of your pelvic floor will be inflamed and you will be paining you. You feel pain around your pelvic region and you even have problems with the menses as a woman. As a man, you have scrotal pain. You'll be having pains around your scrotum. You have infertility. You'll not be able to produce quality sperm. You'll not be able to produce quality egg as a woman. You'll be having so much pain during your menses, These are most of the signs of chlamydia infection, and you need to have yourself checked in case you're having any of these signs. Let's now talk about how to treat chlamydia infection. After having the signs and symptoms, what are the major medications that are suitable for this particular infection? What are the suitable medications that can treat this particular bacterial infection? It is very important you note that some medications might work for you, or most of these medications I'll be recommending for you now might not work in your body because you have what we call resistance. Resistance is when your body is already used to some of this medication. Your body does no longer recognize these antibacterial medications as antibacterial medication. It sees them as a normal thing because your body is already used to them. So even when you take a carton of them and you take a lot of them, they will not work in your body because your body is already resistant to them. So you need other medications that your body is sensitive to, other medications that your body can react to. And that's why I'll be giving you so many medications so you know the major ones that doctors recommend. And it's very important you discuss with your doctor before taking these medications because you might also have issues with taking this medication. You might be allergic to them, and when you are allergic to them, it will cause more problem than even good when you take them. So it's not always advisable you do self-medication. It's advisable you visit your doctor, discuss with him, tell him your problem. They'll check you to know the medications that are right for you, to know what you are allergic for. They'll check your history, they'll check your complaint and everything so they can know the right medication for you before you can start any medication. And one of the medications that doctors will always recommend are medications like azithromycin, erythromycin, doxycycline, levofloxacin, and ofloxacin. All these medications are antibacterial medications that can kill chlamydia infections successfully. But there are times whereby you might need to add up antibacterial medications like 2 or 3 together before you can be able to achieve your goal. Because there are instances whereby you just treat and the infection will just stay like that as if you're not treating anything. It's because you've not combine the right medications together. So you need to visit your doctor, discuss with him. They will know the right medications to combine for you so you can achieve your goal. Now, the same way you can treat this infection is still the same way you can prevent this infection. And it's always advisable you prevent this infection rather than finding ways in which you can treat it, because you might notice this infection when it has gotten to an advanced stage. And don't forget that this infection is one of the major causes of infertility among men and women, because it can destroy your ovaries, it can destroy your uterus, it can destroy your fallopian tube. As a man, it can destroy your scrotum, it can destroy your penis, it can make you have weak erection as a man, it can make you have low sperm count, it can make you to be producing abnormal sperm, it can make you to have bladder issues, cystitis, and other infections like that. As a woman, it can make you to have PID. So it's always advisable you prevent this infection rather than finding ways in which you can treat it, because you might start treating it when the infection might have gotten to an advanced stage. And again, you might have resistance. So even though you take all the medications I've just explained, none of them will work because you already have resistance in your body. So it's always advisable you learn how to prevent it before it gets into the body. And one of the ways in which you can prevent this infection is by protected sex. It's always advisable you take prophylaxis, like you take antibacterial prophylaxis to prevent this bacterial infection. It's always advisable you use dental dams. Dental dams are materials you place on the vagina, you place in the anus while carrying out oral sex. If you're the kind of person that likes oral sex, you like BJ, you can use dental dams to prevent you from getting infections into your body from not just chlamydia infection alone, but all other sexually transmitted diseases. So after watching this video, if you enjoy it, do well to hit on the subscribe button so you can be getting more videos like this. And if you also have questions you wish to ask about this particular topic or any other topic about your health, do well to drop it on the comment section so we can discuss about it. Thank you for watching this video. I will see you next time.